By age 50, about half of all men notice it, a receding hairline or thinning crown. Male pattern baldness, or androgenetic alopecia, is a genetic, hormone-driven form of hair loss following a familiar pattern. A hormone called DHT causes sensitive scalp follicles to shrink over time, producing shorter, finer hairs. Hair loss usually follows stages: temple recession, crown thinning, then merging into the classic horseshoe pattern. A dermatologist can usually diagnose it by examining the scalp and reviewing family history and progression. 2 medications lead first-line therapy: topical Minoxidil and oral Finasteride, both backed by strong evidence. In-clinic options like PRP injections, microneedling, and low-level laser therapy can support medical treatment. Hair transplant surgery moves DHT-resistant follicles from the back of the scalp into thinning areas. Modern techniques like FUE and DHI extract individual follicles and implant them at natural angles. After surgery, transplanted hairs shed, then regrow. Final results usually appear at 12 to 15 months. Every option carries risks, from mild side effects with medications to swelling or shock loss after surgery. Because hair loss is progressive, many doctors combine treatments and plan for long-term maintenance. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.